How to use Viagra safely for the first time. When starting Viagra, adhere strictly to your medical provider's instructions for timing, dosage, administration with food and other precautions. Never adjust anything without their guidance. Here are some general first-time best practices. Take the initial prescribed dose on an empty stomach about 30 to 60 minutes before sexual intercourse. Swallow tablets whole without crushing, breaking, or altering form. Be aware effectiveness varies by individual. Educate yourself on the length of time Viagra can take to work. Typically this can take from 30 minutes up to 2 hours. Note that Viagra is not a magic pill. Sexual stimulation is still required to trigger chemical responses like increased blood flow. Work closely with your partner. Avoid potentially dangerous interactions by not mixing Viagra with nitrates, poppers, alpha blockers, medications for blood pressure and prostate issues, blood thinners, and some other substances without medical supervision. If you find the side effects too uncomfortable, or if Viagra doesn't seem to work as expected, don't hesitate to reach out to your healthcare provider. They're there to help and make adjustments for your comfort and safety. Adjustments in dose or frequency may be required, along with additional safety precautions tailored to you.